Hello beautiful people, once again you're welcome to Ness Ika Show, and of course I am your favorite host, Ness Ika. I promised to bring you a video on choking, and today, ladies and gentlemen, we are going to see how you would adequately assess a choking victim and to properly manage this choking victim. Now, in our daily lives, all of us, not just some of us, all of us are exposed to scenarios which will make us to choke. But the good news is that many a times these choking episodes are simple, and a simple cough is going to resolve it. At other times, choking can become very serious, such that it obstructs the airways, and in that case an individual can end up with a cardiac arrest. Now, how would you know that somebody is choking? There are simple signs and symptoms for you to identify that this individual is choking. First and foremost, you would realize that the person will be clutching the throat. They will be coughing as an attempt for you to dislodge what is causing this blockage of your airways. So the person is going to be coughing, and then the person will be clutching the throat. There can be redness of the face, and then the person, if the choking persists, there may be loss of consciousness and eventually death. So choking is actually an object blocking the airways such that air cannot go in nor come out. So if you see an individual or you see a victim who is experiencing this, what are you going to do? Remember that we are all lifesavers, right? So you need to be able to identify it now. After identifying that this person is choking, what are you going to do? Don't panic, because in the next couple of seconds or minutes in this video, we are going to show you exactly how to manage a choking victim. And then we will also look at how to manage a choking baby, and then we'll also look at how to manage a pregnant lady or somebody who is larger in size than you, how you are going to manage this choking individual. Now, stay tuned as we look at this choking individual. Oh. sorry. So you see that she's choking, and the first thing you notice is that she was clutching her throat, and you see her coughing. Oftentimes what you have to do in a simple choking episode is that you just encourage them to cough more, so that whatever is blocking the airways is going to be dislodged. So if she continues choking and you realize that it is not resolved with the coughing, and oftentimes if the choking is very severe, we may realize that the person is unable to cough or unable to talk. Now, in a scenario like that, what you have to do is you kindly explain what you have to do to the person. Otherwise, when you be carrying out the procedure, they are going to be they will not be cooperative in that procedure. So you have to explain. So sorry, I'm going to hit you on the back to try to dislodge what is blocking the choking. So with the heel of your hand, you hit in between the victim's scapula. So in between the scapula, you use the heel of your hand and hit. As you are hitting, you are giving firm. This is what we call the back thrust. You give it firm to try to dislodge. As you hit, you check. As you're hitting, you're checking if it's dislodged. So if that works, fine. If it doesn't work and the victim continues choking, the next thing you want to do is you explain the procedure to the person. So I'm going to stand right behind you. Then you make a fist with one hand. You put it directly over the umbilicus of the person, what we call the navel. You put this hand that you've made a fist directly above the person's umbilicus. Then with the next hand, you support this fist that you have made while standing directly behind the person. So when you support this fist that you have made and you have explained this procedure to the person, the next thing you want to do is to give an inward and upward thrust. So that's what we call the Heimlich maneuver. So what I will do is I'll push inwards and upwards. So you do this. As you do you check. You are giving and you're checking. You are giving and you're checking. You understand? So as you're doing this, you're dislodging whatever is there. If it doesn't work, you alternate it again with the back blows. So as you're alternating with the back blows, you're also giving the abdominal thrust. Now, remember that, people, this is for somebody whom you can manage, whom your hands can go round their bodies freely. Let us assume that I have somebody who is larger in size than me, or yeah, somebody who is larger in size than me, and my arms cannot conveniently go around this person, what am I going to do? There, I will not give the abdominal thrust, or what we call the Heimlich maneuver. What I would rather do is to give them the chest push. So come forward. So in this procedure now, I'm assuming that this person is larger than me, or for example, a pregnant woman. You cannot give the Heimlich maneuver for someone who is pregnant. So what is preferable in such a scenario is to give them the chest thrust. So in giving the chest thrust, you do the same thing. You make a fist with one hand, you put it in between what we call the breastbone, in between the both breasts of the patient. Then with this hand, you support the fist you've made. Now the difference is that when you're giving the chest thrust, you are not pushing upwards, you are just pushing inwards. So you bring this person forward and you give, that's it. So you push inwards. As you're pushing, you're observing. As you're pushing, you're observing. And once that works, then glory be to God. But if you do all of those and it's not working, and you realize that your victim has lost consciousness, or they cannot talk, and they slump to the floor, you want to quickly assess if they are breathing properly. If they are not breathing properly, we immediately commence the cardiopulmonary resuscitation. In some of our videos, we have looked at how to give effective cardiopulmonary resuscitation to our victims. Therefore, you just want to go to one of those of our videos and watch how to effectively give cardiopulmonary resuscitation, so that, and before you begin this cardiopulmonary resuscitation, don't forget to call for help. Always call your emergency services wherever you find yourself. Call them before you begin the cardiopulmonary resuscitation. Thank you very much, and I hope you've learned something. In our next video, we are going to see how to manage choking in an infant or in a baby. So stay tuned, and thank you for always staying tuned. If you haven't yet subscribed, please do so, and for those of you who have already done so, thank you so much. Don't forget to turn on the notification bell so that you will be the first to be informed when we release new videos. Thank you. I remain your favorite host, Ness Ika. Bye bye.